Hello, Dr. Sarbotham.
Hi.
There are a few questions from the general public with regards to your practice of acupressure and craniosacral therapy.
See, well, basically, acupressure is a very wonderful system. It's a blessing to the mankind. And acupressure is based on utilizing one's body's energy to cure certain ailments. And Carino is also in conjunction to the same thing, but practiced in a slightly different way, which works with more of the cerebrospinal fluids. And acupuncture works more at a muscular level to bring in coordination and relaxation to the muscles, which in direct reflects any problem connected to the same issue.
What would be your core specialties then, Doctor?
Well, I majorly specialize. Over the last 12 years, I was broadly practicing quite a few, treating quite a few ailments. But over the last 12 years that I've analyzed and realized that it's more effective with physiological disorders and more so to do with, spinal ailments. And most probably that I feel that, that my practice especially has kind of confined my approach towards spine elements like slip disc herniation and disc bulge and protruded disc. So there are different variations of the same ailment. So that's what I mainly specialize, or you can say I come as an option for people who wants to undergo a surgery for a back ailment or for a slip disc.
What is that you want to promise your clients?
Well, commitment in the health industry as such, commitment never comes into place. Yes, by and large with my experience I can say what I do has a long-term sustained relief, and also it's much better than any of the other systems as such, so which I have seen it from the last 12 years, so it sustains pretty well.
Right. So would that promise that you are talking about, would it be for the elements you treat and would it last as permanent solution?
Well, see, there's nothing called as permanent as such. Nobody can commit oneself as what we have done is 100%. But yes, by and large, if one maintains himself with appropriate instruction, pre and post therapy, the suggestions what we give, yes, it does maintain to a long term. But we won't claim that it is a 100% solution, and it's not right for us to claim that.
Why do you call yourself as a non-invasive spine specialist?
Well, non-invasive, see, acupressure is usually termed as a non-invasive therapy. So when I'm treating a spine ailment without medication, without any instruments, and with just my bare hands, and also by not using any instruments, I'm using my own bare fingers to manipulate the spine and loosen it up. So it completely claims as non-invasive.
What did you say on people approaching different system of medicine for the same elements like spine related?
Well, see, the approach towards different kinds of therapies, may it be allopathy or homeopathy or Ayurvedic, well, each of them have their own significances. Each of them have their own specialities. I never claim that, I'm superior or inferior to them, but all I say is that, it all depends on how an individual practices a system, how successful can he be, how dedicated he is to that particular system, and how well he is utilizing it. So that answers most of it, because it all depends on how a person practices a system. So that's how it is.
How would you claim, the pregnant women usually have back pains. So how would you say that the therapy is safe for the pregnant women?
You mean to say, because basically, see, during pregnancy, one cannot administer any kind of medication or any kind of therapies during pregnancy, because it's quite fatal for the offspring and all those things. So, but for the last couple of years that I've been practicing, gynecologists in Bangalore at least swear by my practice, and they've been recommending most of their clients who have been suffering from back pains, and it's one of the most safest therapy that one can claim during pregnancy for back pains.
Thank you, doctor. And would you have a last message for our general public?
Well, in regards to health?
Yes, definitely.
Yeah. See, well, I always say that 24 hours in a day is a very long day. at least why don't you remove about 20 minutes to start with, to start some exercises, and to make sure that, and to make sure that, at least you do about 20 minutes of practice or some kind of exercises, so that, you have an upkeep of your own health.
Well, thank you for that, doctor. Thank you so
Thank you.
much.